We feel proud to give our topic today, which is the artificial intelligence and metaverse in surgical oncology. As a surgeon and practicing surgery from 1998, 7 years, and we lived the revolution and the changes that occurred to the surgery and the amazing changes from the start till now. So we feel proud to reach this state. And here we feel proud to manage and found the Metaverse Surgical Hospital. The age of this hospital now is 2 years. If you visit the hospital, you can smell the blood and you can see the life surgeries that we did and the saving of lives that we will see together in the lecture, and the training workshops and the programs. And also we feel proud to manage the artificial intelligence surgery with the Canadian Specialist Hospital, Dubai, UAE, and also the research program of the Artificial Intelligence and Meta Research Center for Space and Medicine with Magna Gracia University with Professor Michelle Amanda. So today, we will speak about the combination of the artificial intelligence and metaverse, and these powers, when combined together, what we can reach in surgical practice. And all of you know, as any surgeon, and especially the surgical oncologist, needs an experience and preoperative preparation in order to achieve a success rate in these tumors, and also to save life with less complication and amazing result. So a quick: artificial intelligence is the theory of development of computer systems which are able to perform tasks normally requiring human intelligence. And of course, we depend on this, which is learning, reasoning, problem solving, perception, and language understanding. We were able to develop like a small child and to rise the advanced technologies that you will see with the progress and the start of these technologies month by month. And of course, the virtual reality, it is a fully artificial environment. The augmented reality, it is a virtual object overlaid on a real world environment. And the mixed reality, it is a virtual environment combined with the real world. And of course, these are important. So the technologies of the metaverse and the fourth powers of the metaverse, which are the augmented reality and virtual reality, the artificial intelligence, the blockchain, and the 3D reconstruction and Internet of Things. For us, when we saw this photo before, let's say 4 years back, and when we started to combine what we have together, we found ourselves working on augmented reality. We did the first surgery between Dubai and Tokyo using the augmented reality. It was a gastric sleeve, and it was published with many universities. And after that, we saw ourselves working on artificial intelligence and the 3D reconstruction, and on the metaverse when we founded the hospital. So when we combined all these four powers together, we reached to a state that you will see, which is a superpower of science that we feel proud that we are using now in surgical oncology and even in the space telemedicine and telesurgery. And of course, the artificial intelligence and metaverse in surgery, we can divide it in the preoperative planning, in the intraoperative guidance, and in the surgical robot, which is the intraoperative, and also in the postoperative. So what we did, let us see this gentleman. We feel proud to implement, and this is the avatar, which we using now for cancer screening. So as a surgical oncology, we told ourselves, no, don't let us treat the disease when they occur. No, let us attack prophylactically. Let us reach the people in their homes and let us screen the cancer. So what we are doing now is a special program that you can, by your smartphone or your website, in one click, this avatar, like an angel, will come to your home, and he will tell you, today you are 52 years and you are a male. So we want to scan your prostate and to make you colonoscopy. And of course, with another click, a nurse will come to take your blood, and after that to make you an appointment for colonoscope or prostate cancer detection in order to screen the diseases in the early stages. And this is called the Avatar Cancer Screening Program. And we started this, and it's now presented in Dubai. And we feel proud that yesterday the international was scientific progress of the artificial intelligence, and UAE was the second country. And of course, we feel proud to every scientist who are reaching this level. And after that, when we combine these together, we told ourselves, let us combine all these in a hospital. So I called an expert engineers in USA, and we're proud by them, they are expert. And I told them, I want you to build a hospital with a reception, with an outpatient department, with an inpatient department, with an operative theater, with AI, in order to start receiving the patient and putting all the technology that we have, the robotics, the virtual reality, the AI, and the cancer screening and all. So what we did, we started to give them what we have, and they started to build a scientific structure, which is called the Metaverse Hospital. And after that, we mixed the operative theater of this hospital with a real operative theater. And so, as you can see, connected with real operative theater, with robotics and virtual reality, and to train the surgeons on these technology with an advanced robotic arm controlled from distance by virtual reality and AI, and also a special avatar, which is called the avatar telementoring. And we were able to introduce an avatar. That example, you have a rare surgery, you can contact the hospital or our association in order to send you an expert avatar in this specialty. Let's say that you are having a liver transplant. He will be on your right side like an angel, supplied with AI, controlled by a human, and he can guide the surgery, and even he can do the surgery from distance if we have a robotic arm connected with the hospital. And of course, what are the advantages of the metaverse surgery or the virtual reality? It is gathering experts in one place, supervising the surgeon and surgeon training, seeing the surgical field in a 3D reconstruction manner. And you can see, as we said, in the surgical oncology or organ transplant, seeing this structure, especially, let's say we are having a congenital anomaly in liver transplant, or there is a tumor in the stomach, and there is congenital blood supply abnormalities. When the surgeon see this before the surgery, of course, his life will be easier, and he can identify. And of course, when he sees the tiers of lymph node affected, he can make a plan with artificial intelligence in order to guide and go to the surgery. And of course, the telesurgery and telementoring that we are using now to do surgeries between Earth and also to the International Space Station and the space exploration missions. So here, this is our system. So what we did, we combined the two operative theater. Let's say one surgeon is doing a lap cholecystectomy, let's say in China. So what we do, we train their IT people, and we send a metaverse engineer to train them. After that, with the special programs that they will have, example, a special laptop computer, a Wi-Fi, and a smartphone or the virtual reality camera, and the surgeon is operating to do a laparoscopic cholecystectomy. And this system will automatically transfer all the video live information to the metaverse surgical hospital in the field. And there will be a special program which is guided with video artificial intelligence that can read the anatomical structure. We just give him example that today we are going to do a gallbladder or anterior rectal resection or prostatectomy or ERCP, pancreatic head tumor. So we must identify the system so that the artificial intelligence system will be guided. And of course, there will be an avatar supplied with AI and also a human supervision. For me, all my request to the governments now is that these artificial intelligence programs, whether robots or automated program, will never be left to work alone. So my recommendation to all, and of course, I will be ready to answer any questions from you and from the audience, that these systems must be controlled by humans always in order to have the safety. So example, the surgeon will be guided. He will start to see the two field, let's say red and green. So if he is dissecting on the green area, it's like a traffic light. When you go to green, this means that you are in a safer zone. You are near the cystic artery and cystic duct, you can go forward. And if you are going to the red zone, there will be an alarm system. This means that you are near the dangerous area, let's say near the common bile duct or near the plexus of the rectum or the prostatic plexus of the important nerves. Supplying these technologies, this is called artificial intelligence guided surgery, and we succeeded and we are improving the program better and better. So now we are supplying, as I told you, with an avatar, like an angel on your right side, with a direct video camera system, and of course, with the 3D reconstruction. And the nice thing that our patient can reach the hospital either from their smartphone to do the reservation, or by virtual reality camera, or by ordinary websites. And here, these are some real surgeries that we feel proud to do. This is a story of a gentleman, 8-year gentleman, who was having stage 4 prostatic cancer. And of course, they told him, go to home and die. Why? Because failure of chemoradiotherapy, he is unfit for surgery. He was having diabetes and coronary artery disease and so. So his son is an engineer. He started to, some people, they don't lose hope. So he started to see if there is an advanced technology, and he found our programs and our hospital. He contacted the hospital, the surgical oncology department. And of course, we are having our AI systems, including an AI agent, which is a modern agent that has all the ChatGPT, the Manas, the other program, and the Grok all together. And we made an agent. This agent helped us in the preoperative and the intraoperative. And this agent told us, using laser, prostate tumor ablation will give you an amazing success. So what we did, we made a plan. We gave it to the MDT board. And of course, the MDT board were amazed. And of course, the patient agreed for the surgery. The nice thing, this surgery was done in Baghdad, and I was in Dubai. I sent myself to an avatar to Baghdad, okay, because I built there a private hospital supplied with all this advanced technology. And I was on the right side of the laser treating intervention team. And after that, we entered inside under local anesthesia. We entered inside the heart of the prostate tumor and fire, and using AI to monitor that we are inside the tumor. And after that, there was an ablation. We put our patient on hormonal therapy. The patient now is 4 months post-operative. He started to gain weight, and we were able to control his tumor. And this is a real story about the success of using an avatar telemonitoring with AI, a laser system, and laser ablation. And this is one of the revolutions. And the other thing is that we started to do workshops. When we saw the result of our patient and our training program, so we started to invite professional surgeons and train them on these advanced technologies in workshops. Till now, we have done more than 20 workshops, and we are teaching the surgeon how to use the virtual reality camera, their smartphone, these AR-guided programs, and to control these robots. And this is a real workshop where we succeeded to monitor a radical life robotic prostatectomy using the Tomai surgical robot. And many surgeons attended. The nice thing in this workshop that the surgeon can attend in 2 forms, either in a physically, they can come, or they can come in an avatar. So you can come in an avatar form, like you can see in the screen, and you can sit in order to be trained. And we feel proud that Professor Michel Amenda is now our chief surgeon in Europe, and he is carrying our flag to train surgeons and to participate in our work and research programs. And of course, we will feel proud if we have a branch in China in order to expand this amazing work more. And this is what are the advantages of the Metaverse Hospital. So 1, reducing the risk of infections. 2, speed recovery times. 3, the global collaboration of surgeons, like what you saw. 4, access anytime and anywhere, saving time and money. 5, the virtual reality and the 3D reconstruction and operative theaters. 6, the telemedicine and telesurgery. And 7, the innovate surgical options, artificial intelligence, virtual reality, and the laser ablation that you saw. And 8, advanced health services to space and the space exploration mission. We feel proud that our technology was approved with NASA to provide the avatars to space and also for the space exploration mission. And we are having now a special program for the moon base in order to supply the surgical and medical care using these technologies. And of course, we are putting the AI in endoscopy, and you can see many companies like Olympus has its AI guided endoscopes. And in such, if there is any lesion, you cannot miss, because also an alarm system will be activated in order to tell you that this lesion is suspicious, take a biopsy, and of course, we can save lives. And of course, the ERCP and the pancreatoscope. These are very advanced stethoscope. If you can see on the right screen, on the top, there is an area of green and red. So example, if the surgeon putting his ultrasound in order to do a direct invasive treatment, if the full screen is green, this means you are in the safe side and inside the heart of the tumor, you can go and take the biopsy or you can fire the laser. If it is on the red side, this means no, adjust your ultrasound probe better so that you will be inside the organ. So this is an amazing localizing program we are using now in laser ablation and also in attacking these tumors by teledistance, from distance. And on the right side, you can see the ERCP and the advanced pancreatoscope. So imagine now we can see the inside of the duct of the pancreas, and also with AI program, we can see if there is any suspicious lesion, we can take a biopsy and in order to treat our patient in early stages. And these are some of how we do our telementoring. Either you will see live Professor Mohanad or the AI agent. And in all, as I told you, the human control is a must. So whenever I'm having a surgery, and I feel proud to control surgeries by these technologies between Dubai and USA, Dubai and Japan, Dubai and Tokyo, Dubai and Baghdad, and Dubai and Europe with the Magna Gracia University. And of course, Professor Michel will tell us about what we are doing. This is the important Metaverse hospital of work. Yes. And here you can, this is a head pancreatic tumor. This patient was 82-year-old. You can see that on the right side, it's a 4 centimeter. And on the left side, we succeeded to abolish this tumor by laser ablation, also using the avatar telementoring and the laser from distance using the AI program and localization systems. And here, these are some automated tissue recognition. We are using the color systems now. And as I told you, we are developing the programs now. And there are many companies working on this. So you can see the colon, the peritoneum, the fat tissue, and the diaphragm, and the liver, and the arteries, and the blood. So the surgeon, when he is doing the surgery, whether laparoscopic or robotic, or even laser, he will have a guidance program in front of him so that he will don't lose the way in the surgery. And if there is the ureter, or if there is the vascular or the neurovascular structure, he can see and protect and save lives. And here, this is our operative theater in Canadian Specialist Hospital, where I manage the artificial intelligence and robotic programs. And I feel proud to receive international patients from all the world. And you can see that this avatar is my angel. He is on my right side, supplied with AI. And here we are using also an amazing robot. We are using the Da Vinci robot. We are using also a robotoscope guided with AI from robotoscope company and with surgical oncology and AI guided arm that can give me an 3D magnification with a control. When I move my head, the arm move with me and I can do delicate surgery. And of course, we feel proud to introduce these technologies to the hospital that we are making collaboration with. So I hope that I will open a branch in China and collaborate with the scientists of China to improve our technologies more and more, and also to attract these technologies. And in such, I will reach an end to my lecture. And of course, I will be happy to receive your questions after we finish the lectures. Thank you very much, Professor Dr. Mohanad Al Ansari.